Hi everyone, it's Dr. Mayura, and today I'm going to be speaking about something we've all heard about, heart attacks, also called myocardial infarctions. So this comes under cardiovascular disease, which is the leading cause of death worldwide. More than 31% of the world's population dies due to heart disease, and 1 out of 3 people are dying either due to a heart attack or a stroke. So this is very significant. So it's very important to me because 12% of people who do get heart attacks end up dying. So it's important to understand the warning signs, or to understand the symptoms, and to reach the hospital as soon as possible if you are experiencing any of these symptoms, even if they are vague and you're unsure. So now, what is a heart attack? Let's break down the word myocardial infarction. Myocardium is nothing but the heart's muscle or tissue, and infarction is nothing but a loss of blood supply to a tissue leading to tissue death. So myocardial infarction, when you put these two together, is loss of blood supply to the coronary arteries, which supply the heart, or one of the coronary arteries, leading to death of the tissue there in the heart. Now, that is extremely significant. And also, myocardial infarction is complete blockage of blood supply. If there's a partial blockage, you would have an angina, which can be divided into stable or unstable. When you have a stable angina, it's nothing but if you're exerting yourself or if you're stressed, then you have chest pain. But when you rest, your chest pain goes away. Now, unstable angina is an emergency where if you're at rest, you have chest pain, and it's not going away even on, if a tablet like nitroglycerine. So at rest, when you have chest pain, that is called unstable angina. So an unstable angina, you need to go to the hospital because it can lead to a heart attack, because there's a blockage which could dislodge into a clot and could completely occlude a part of the heart, leading to irreversible damage. So the heart is supplied by coronary arteries, and these arteries, there's a main coronary artery and it branches into right and left, and they branch further to supply different parts of the heart, or maybe the anterior portion, the posterior portion, or the inferior portion, or the septum. So the occlusion can happen in any of these coronary arteries, but we find that most occlusions happen in the left anterior descending artery, which supplies the anterior portion of the left ventricle, which is the left ventricle pumps blood into the aorta and to the rest of the body, oxygenated blood. So that's the most common. And as doctors, when you go to the hospital with symptoms of a heart attack, your doctor will do an ECG, which I'll elaborate on later, to see where the blockage is and in which part of the heart the blockage lies. Now, what are the 3 causes of heart attack? The first one is the most important and most widely seen, which is arteriosclerosis. What is arteriosclerosis? Arteriosclerosis is nothing but a buildup of fat, cholesterol, protein, calcium, white blood cells, all build up on the arterial wall. And arteriosclerosis, slowly, it's called a plaque when all of those build up. And these plaques can narrow the artery and reduce the blood supply, causing, of course, angina, which is chest pain on exertion, stable angina, or unstable angina, or complete blockage where the plaque ruptures. And when it ruptures, all your platelets, they come from different parts of the body, and they come and they form a clot, and that clot blocks completely blocks that coronary artery, so that no blood is reaching the heart, and your heart cells are dying. Now, heart damage is irreversible after 30 to 40 minutes, so it's extremely imperative that you reach the hospital before that. So that is one. So arteriosclerosis is a main cause of heart attacks. Secondly, you can also have a coronary spasm. That is when your coronary artery just spasms like this. This is the artery, it just spasms, and therefore it blocks blood supply depending on the length of the spasm. This can happen in drugs like cocaine, and it can happen in stimulants like with amphetamines. So you have to be very careful. Now, you can also have something called a coronary artery dissection. A coronary artery dissection is when the artery is made up of walls. So when there's a tear in one of the walls and blood flows into that and forms a bulge, then you can have blood not going to the heart. So that usually happens in young and active females. But the common cause of heart attack is arteriosclerosis. Now, what are the risk factors for atherosclerosis? There are modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are things like smoking, hypertension, diabetes, obesity, high cholesterol, an inactive lifestyle, and stress. Non-modifiable risk factors are like your age. So men at over about 40 to 50 years old, men more than women, increasing age leads to increasing heart attacks. Your race, African Americans and Asians, have more propensity to develop heart disease and heart attacks, and genetics, of course. So if you have a family history of somebody in your family, whether it's your grandmother or your father or sibling with heart disease, you need to be extremely careful. So these are some of the causes of heart attack. Let me talk about the warning signs of heart attack. This is extremely important. I think actually this entire thing revolves around this. Is how do you recognize what are the symptoms of a heart attack? So the symptoms can be vague, and they can also they can also be very specific, like chest pain. So I think we all hear chest pain as a symptom, right? So if you're having chest pain, which is it's like an elephant sitting and pressurizing or heavy or very tearing or burning or stabbing, which is not, you can't localize it, but it's more diffuse, or it's radiating to your left arm, your shoulder, your jaw, your back. All of these are signs of heart attacks. Now you can also have signs like diaphoresis, which is sweating. So you'll notice beads of sweat on your head, perhaps when you're actually cold and clammy and you look gray. So you have cold skin, clammy skin, but you're having beads of sweat. It can also be shortness of breath when you're gasping for breath, or you can have symptoms of nausea and vomiting, or indigestion. You can say, hey, I'm having a lot of gastric symptoms, indigestion. That can also be a heart attack. So you can have dizziness, you can have chronic fatigue as a symptom. So there are many symptoms which are non-specific, and it's important, if you have risk factors, to be extremely aware of these symptoms and not wait to go to the hospital, because time is muscle, and the more you wait, your heart muscle is going to die. So go to the hospital even if you are not sure if you're having a heart attack. And if you do have chest pain and you think it's a heart attack, please take 325 milligrams of aspirin. Keep it with you to help. It can really help prevent irreversible damage. And aspirin prevents the platelets from coming and forming the clot. So I think this is important, and it's very important to know that it doesn't matter whether you're not sure if you're having a heart attack, or you just suspect, or you think it's just indigestion. When you have symptoms and anxiety about it, immediately go to the hospital, because you can save your life, you can save your heart, and time is essence. Time is of essence, and it's better to err on the side of caution than to have irreversible heart damage. You can also have a silent heart attack where you don't have any of these symptoms, and that usually is seen in diabetics, because diabetics have something called peripheral neuropathy, where their nerves are damaged, so they don't feel the pain. So diabetics have to be extremely careful. They may not know that they had a heart attack. Also, in women, usually the signs are not as prominent as in males. They're not as specific as in males. So a woman can actually just feel very fatigued and anxious and have a heart attack. So people with risk factors have to err on the side of caution and always be careful. Now, when you have this and you take your aspirin and then you go to the hospital, what are your doctors going to do? They're going to do a physical examination and measure your BP and heart rate. They're also going to send you immediately for an electrocardiogram, which is an ECG, which measures the electrical activity in the heart. So you can see if the heart is functioning correctly. Now, in the ECG, there are some changes they notice, which are ST segment elevation and ST segment depression, hyperacute T waves or T wave inversions, or pathological Q waves. Now, these are all showing what type of attack is it. Is it a complete occlusion? Is it a partial occlusion? Is it ischemia? Is it where in the, depending on which lead the change happens, where in the heart has this occlusion happened? So your doctor will be able to figure out all that information from your ECG. Now, after that, he will send tests called troponins. Now, these are all cardiac markers, serum cardiac markers. When the heart tissue gets damaged, it releases some enzymes or proteins, and these proteins are released only with heart damage or damage to these tissues. So your troponins are these specific cardiac markers which are released about 2 to 4 hours after a heart attack and stay elevated for about 7 to 10 days after a heart attack. So these are the most specific markers for a heart attack. Now there's also another marker called myoglobin, which is released within 1 hour. The heart muscles, the damaged heart cells release that myoglobin within 1 hour of a heart attack, but it's not a specific marker, so it's not used very often. There's also another marker called creatinine kinase MB, which is a marker which is released by the tissue, the damaged tissue, within 4 to 6 hours, and probably it goes down at about 48 hours. So your doctor is going to order all of these tests to confirm whether you had irreversible damage or a cardiac injury. And now he might even do an echocardiogram. So an echocardiogram is nothing but ultrasound of the heart to see if there's any damage and where the damage is. Now, you usually will be taken to the cath lab. I'm sure all of you have heard about cath lab. So in the cath lab, they will do a coronary angiography. So in this coronary angiography, they basically put a catheter inside, either from your arm or your groin, and they lead it up to the coronary arteries, and then they inject a dye, and then they view it, and they see how the dye is flowing through all of those arteries, and they can see where the blockage is. Now, if there's a complete blockage, they might go do an angioplasty, which is putting a balloon catheter in and going through the coronary artery, and that where the site of blockage, and opening the balloon, the balloon to expand the artery, and then maybe putting a stent to keep it expanded. Now, so they can also, in some cases, do a coronary artery bypass surgery in some specific cases, usually when you have pathological coronary arteries. And so basically they will take an artery maybe from your leg, and then they'll bypass the blockage, and they'll, below and above the blockage, they'll attach the artery, so blood flow will resume as normal through the new artery. So there are many interventions that can be done. There's also something called thrombolytic therapy, which can be done if you don't have access to a cath lab, where they give you thrombolytics, which are some drugs which bust clots. So there are a lot of things that your doctor will do. So, but it's most important that please, if you have risk factors and warning signs for heart disease, be vigilant. To prevent this, you can do things like you can definitely control your hypertension, you can control your diabetes, you can keep it in check, you can reduce weight, you can exercise 150 minutes moderate exercise a week, 2 times a week strength training and resistance training. A heart healthy diet, please Google that, a heart healthy diet, which is very rich in fibers, low in fats. You're trying to reduce your cholesterol and reduce stress. So yoga, meditation, mindfulness, positivity. So there are many ways. So please deal with and if you can, you should watch my other videos about the risk factors like cholesterol, hypertension, and diabetes. But and smoking, of course, very importantly, smoking is a very, very important cause which erodes these arteries and creates easy buildup of plaque. So please stop smoking and drug use and excessive alcohol use, because these can really cause heart attack if you're at risk. So prevention is better than cure. Be vigilant, be aware, and I hope this helps. Thank you.